As you've just said, I'm from the Institute for Reconstructive Sciences and Medicine. A recent visitor to RSM actually called us or described us as Project Spare Part Human, and we rather like that descriptor, so we've decided to keep it. Advance? Do I have to point it?
Right hand.
Right hand.
Right hand.
That one?
That one.
Okay. So RSM is an internationally recognized research group who puts research into practice by integrating clinical and academic environments. We're a powerful joint initiative between Alberta Health Services, Covenant Health, and the University of Alberta, with Alberta Health Services and Covenant Health providing the clinical infrastructure and expertise as academic healthcare institutions, and the University of Alberta providing research expertise, collaborative opportunities, and funding options. RSM is committed to providing patient-focused, integrated, interdisciplinary care with a focus on value. We provide improved patient outcomes through quality, environment, and we translate research into the clinic to improve patient outcomes. And I'm sure I'm positioned just before lunch to decrease your appetite, because I do warn you that some of the next slides might be considered a bit graphic. Fundamental to all aspects of RSM is osseointegration, which is basically bone integration, usually of titanium implants, either within the within the facial region, so that's outside of the mouth region, or within the oral cavity. Examples of these applications include ear reconstruction, where this lady had a congenital malformation of the ear. We put in titanium implants, attached a bar to the implants, onto which these prosthetic ears will be attached. The ears were generated through digital technologies, scanning her normal ear if she had one, and building through rapid prototyping technologies and our anaplastologist a new ear, which, as you can see, is pretty damn good. This lady had cancer of the eye, which required removal of the whole orbital apparatus. And what we've done is implant some titanium implants, attach magnets to these, and her prosthesis attaches magnetically to the implants. In the case of ear reconstruction, we advocate using the patient's own tissue. This young boy had microtia, which is malformation of the ear. And what we've done is, again, use his normal ear, reverse the scanned image, and build a template from which to cut cartilage and reconstruct his ear. This is a father and daughter who both had bone-anchored hearing aids attached. This is a photo from the Edmonton Journal this year. Bone-anchored hearing aids are used when the outer ear has a few issues and the cochlea is working normally. So what we will do is implant a titanium screw, attach an abutment, and attach to that a processor which vibrates the skull. 50% of what you hear of your own voice is vibration through the skull. And so the Baha enables these individuals to actually hear again. Finally, we work in the area of major jaw reconstruction. This may be due to cancer, trauma, or congenital malformation. And as you can see, her jaw has been reconstructed, titanium implants inserted, as you can see here, and then dentition attached. And I don't think you'll be able to tell from the final photo that she's had such major reconstruction. Our research philosophy at RSM is not to do research for research's sake. We aim to solve problems. We work with researchers across 5 faculties at the university as well as internationally, and we provide the means to assemble project teams that will be responsible for addressing a patient problem that we're trying to solve or to meet the needs of industry. This one. Our focus of research and innovation is to meet unmet patient needs and clinical needs, and which establishes the difference between RSM and the academic environment. We're closer to the market. We have patients who tell us their patient needs. We have clinicians that tell us clinician needs, and we have surgeons that tell us their requirements. We also provide access to patient populations for clinical trials, and we have 5 research laboratories within RSM. RSM's research focus is both on research that will improve the way we treat our patients and also innovative product development. RSM's activity focus clearly fits within the musculoskeletal market, which in 2008 was a $20 billion market. And some of the research projects that we're undertaking are the robotic eye, for example, the lady with the prosthetic eye. The main complaint from our patients in that regard is that people talking to them will look into the eye that doesn't move. So how do you get the prosthetic eye to move? And you can't use a motor because the skull is a very good vibrator of sound and vibration, translator of vibration. So we have a patent out right now using memory shape alloys. The other one is the there you are. Wholly implantable bone-anchored hearing aid, because a lot of the patients don't like having this little square box attached to the outside of their skull, naturally, and a number of technologies to address implantable medical devices. So clearly a focus for RSM is the development of medical devices, and we're meeting the opportunities within the development of these devices through CIMED, which is our Center for Implantable Medical Device Development. It's a cooperation between RSM and NINT with participation from neurosurgery, the U of A Mechanical Engineering Department, as well as UCLA and University of Toronto regenerative medicine groups.